In the medical field, particularly in surgery, there are errors that are termed never events, basically errors that should never happen. These include operating on the wrong patient, operating on the wrong body part, or operating on the wrong site, even if the body part is correct, or even operating on the wrong side of the body. These are very terrifying, particularly for the patient, and has dire consequences on the medical professional found to have made that mistake. In the recent past, at the Kenyatta National Hospital, brain surgery was done on the wrong patient. These expose the loopholes and the deficiencies that exist in the system, not only at the Kenyatta National Hospital, but in any facility that is offering any surgical procedures across the country. On Health Digest, we look at what it means to undergo safe surgery, right from when you are admitted at the facility or at the hospital to the theater and after being discharged from theater. Surgery requires team effort and proper communication among all the team members involved. It's not only a surgeon's job, and we shall be talking to the surgeons, the doctors, and the nurses, and even the hospital administrators, just to tell us what their role is in making sure that you are safe for any surgical procedure that may be prescribed for your health.
Now, when you or your family are informed, where I say your family is because we do have people who are not able to give consent, either due to age or due to medical reasons, when a decision is made by the surgeon that the patient needs to undergo a surgical process, the anesthetist is called in to be able to come and assess the patient, ensure the patient is at the best level possible to undergo the surgery. When I say best level possible to undergo surgery, I will give a simple example. For instance, if I'm an old man, a very old man, who is not in good nutritional status, not well fed, quite wasted, you need to actually be brought up to the point whereby when you undergo the surgery, your tissues can actually heal from that. So the anesthetic experience includes assessing that patient, talking to the patient and the primary concerned relatives in a confidential manner to ensure that that patient is in the best state possible to withstand the insult of surgery. I say the insult of surgery simply because surgery means your tissues are touched, they are handled, they are distorted, and sometimes from that distortion during the healing process, you might take longer than usual to heal, or you might heal in different ways. So we must make sure you are at that best possible state to undergo that. We also discuss with you the options that we have to be able to give you that anesthetic, because some options, for example, if you're on medicine to thin your blood, would actually mean we cannot give you some of that kind of anesthetic or that kind of intrusive process. We probably have to get to a better place. If, for example, you have other diseases like diabetes or high blood pressure, etc., then we need to get you to a state whereby those things can actually not become a hindrance in the healing process after surgery has taken place.
Habari yako? Naitwa Dr. Githome. Ninafanya kazi kwa saidi ya upasuaji. Jina yako ni? Jacinta Wibira Bashara. Alright. Jacinta, shida ya leo ni gani? Tumbo inawasha. Alright. Sasa leo tunafanya procedure inaitwa endoscopy.
I could see that her file is written she's allergic to penicillin. Is this like something of concern? Are you supposed to check maybe her blood level? What are the pre-op checklists, or what is the pre-op checklist, just apart from her signing the consent, that you really need to look at so that you can say, now we are ready to take this patient for the endoscopy?
So the pre-op checklist will include her biodata. What I mean by biodata is her name, her age, and where she comes from, gender also. Apart from that, we look at something called the vital signs of life, which include the respiratory rate, the blood pressure, the temperature, and the pulse rate. Yes. Then we look at the past medical history, whether or not she's allergic to a type of medication that we may be using in theater or not. That's very important. So the drug and food allergy is also a very important history.
Jacinta, habari asubuhi. Sasa vile wameeleza wewe, hawa daktari ndio wameandika hapa. Kumaanisha unajua vile tutafanya, okay? Na umesoma hiyo mbeleni kuona imeandikwa kitu gani, ndio unaweka sahihi kukubali tufanye hiyo procedure. Sawa sawa? Asante sana.
When taking consent, or in this particular part of the preparations before surgery, what are the loopholes that might be of potential danger, if I may call that, to the patient if they are not really adhered to?
The patient is supposed to look at the form, see what is written on the form, and match it with what we have described. And then the patient should sign the form. So the patient must understand what the patient is signing. That is one of the most important things. From the loopholes point of view, it depends on the nature and type of surgery that you are doing. If it's a straightforward procedure like an endoscopy, then things become not that important. But if you're doing a major procedure like a laparotomy, then it is important that you go in the detailed format of what are the complications that are likely to occur at the end. And the most important thing is to make the patient understand that when the patient wakes up, there may be a tube in the nose, there may be a tube sticking out of the abdomen, there may be a tube in draining her urine, and those sort of things are most important to mention when you're taking a consent about the procedure and all that.
What should the nurses and the doctors do just to make sure that whatever content is in the file matches the file name and also the patient, so as to avoid any mishaps that may happen even just before going for surgery?
So I think the most important thing there is that every person has a designated job to do. For example, the records officer in the wards is supposed to collect the results, the lab results, and put them in the file. The nurses interact a lot with the patient, and the nurses are supposed to make sure that the patient and the file are of the same person. Secondly, when the consent is taken, the nurse brings the patient to the doctor's attention, and the doctor then takes the consent. So there are every step which is important, which have to be followed, all right? And putting an identity band on the patient and expecting things to work out is not the answer to the problem. The answer is that every person has to do his job, and at every step, no corners are cut, and then we will not have any problem. So the first one is the first contact of the patient in the clinic. The second one is in the ward, or in such a scenario, in the casualty where it's an outpatient procedure, and you do these things. In the ward, you would take a consent, check the blood works, check the pre-operative preparation of the patient, whether antibiotics are required, whether a drip is required, what's the output. All those are level 2. And then level 3 is actually in theater, where we'll proceed now.
In that pre-anesthetic bit, we discuss with you what you are to undergo, what options you are to undergo, what methods or measures we can take to bring you to the best possible state for you to undergo that. That is for planned or elective surgery. In emergency surgery, of course, that changes because sometimes you have to save either life or limb, and so you take measures which are appropriate to ensure that as much as you may not be in the best state possible, we can minimize the disruptions that would occur.
We have to go through the pre-operative checklist with the patient, and then we'll have to fill it, and then we if there is any lab work needed, we have to follow. Then we have to take the vital signs of the patient and record them if they are stable. If they are not stable, we refer him to the medical officer who is on call today. Kwa jina unaitwa Jacinta.
Once we have given the go-ahead for the patient to have a procedure, we have had a discussion with the patient, the relatives, and taken what you call consent. And by consent in this instance, does not just mean you being told sign this document. It means you have discussed at length what is to be expected during the procedure, what should be done before the procedure, and what is expected during the healing process after the procedure. Once that has been done, we believe that you must have strong teamwork for you to get a good outcome. So usually, before we anesthetize a patient, We normally have prepared monitoring for the patient. By monitoring, I mean we have gadgets and we have procedures to ensure that during all the time the surgical beat is happening, the patient, we are able to keep on top of the assessment of the patient's response to any of the drugs being given and any of the procedures being done.
We hand over the patient plus all the documents. Then we'll have to go through the checklist again to confirm the details of the patient to the receiving nurse.
Daktari atakuweka tube, itapitia kwa mdomo, alafu ifike hadi kwa tumbo. Wakati utakuwa unaangaliwa, hautasikia uchungu, lakini utasikia tu discomfort kidogo. Lakini kabla, utalala na upande wa left. Ukishalala na upande wa left, utaekwa spray hapa kwa throat. Itakufanya ugande hapa kidogo, alafu pia utapewa dawa. Hiyo dawa itakufanya ulale na pia itazuia uchungu. Kwa hivyo utasikia uchungu ukifanywa hiyo procedure na hautakata mahali popote, sawa. Alafu ukimaliziwa utakuja hapa, utafanywa hapa ndani. Ukimaliziwa utarudi hapa, alafu utaamka polepole, sawa sawa. Uko na maswali yote? You check the patient, whether it's the right patient. So the details of the patient, you confirm with the patient. And then after that, you have to ask the patient the procedure that they are going to be done. Like the way I asked her, she told me that she has issues with her stomach. And then after that, you need to check whether she has any allergies. You need to check that she has signed the consent, which she has. And then you got to also check this checklist, whether it's there, the nurse has done the vitals and anything that maybe was critical, you get to note that too. And also, we also need to have the theater clearance form, this one, so that the patient has been cleared for theater. And basically now then you come and check the vitals, yeah.
We look at how fast your heart is beating, how well it is beating, and whether you're having a blood pressure, because the blood pressure means you can push blood around. Also means we are looking at whether you're getting enough oxygen or not to ensure that you don't have any damage to your vital organs. We also look and make sure, and we sit with the patient through the whole procedure from start to the end to ensure that suppose something out of the ordinary is discovered, for example, in surgery, or you have a reaction, maybe an allergy or some of the drugs, we are on top of the situation. So it is not an issue of giving somebody some medication and going away with timing, but an issue of giving someone something and sitting and responding time by time, walking the journey with the patient until the procedure is done. Teamwork is not an easy word to define, but certainly you can tell when the teamwork has been good or not by looking at the outcomes. The people all together must know what are they looking for. So what is the task at hand? What is the expected outcome? What are the possible pitfalls? And what are the things to look out for and watch out for one another. So basically, we can cover each other's back in case of any issues, looking out for blind spots, not covering the back in a negative sense, but ensuring that since every member knows what you're looking for or what are the pitfalls possible in that procedure, then someone can be able to raise an issue and say, for example, that blood pressure is like this, or are we not bleeding too much, or shouldn't we do the following things before the process is taken?
One of the most important things is timeout. All right, you identify the patient, identify the site of the operation, all right, and then identify the team members who are going to be involved in the procedure.
Go through the surgical timeout. So the team members will introduce themselves. My name is Dr. Mwanzia, surgeon.
My name is Pankaj Jani. I'm the
my name is Josephat, endoscopy technician.
I'm Rachel, endoscopy technician. I'm Carol, I'm a nurse.
I'm Mr. Mani, I'm the in charge of theatre.
Our patient this morning is Jacinta Waidera, an adult female.
What is the procedure?
The procedure we're going to do is an upper GI endoscopy.
And position has been done?
The position is the left lateral position, yes.
So are there any anticipated critical events?
It's a straightforward procedure, but you need to be careful with the drugs that you administer, the right amount and doses of sedation that you give. That's very important, because in the past that has brought problems. Besides that, there are no other major issues we anticipate.
Anticipation length?
15 minutes.
Okay.
Thank you. So we start by spraying the throat with the local anesthetic xylocaine spray. Tafungua mdomo mama. Tunaweka dawa kidogo kwa mdomo. Hii ni dawa tu, hakuna chungu. Sawa? Haya. Meza dawa, meza. Tusikia kama kona ganda kidogo, alright? Meza tena. Haya, lala kidogo. Position the patient now. Okay. Tufungua mdomo kidogo. Tuweke hii kwa mdomo, utashika na meno. Sawa sawa. Tutapitisha mpira hapa ya kamera. Alafu mpira unapita kwa tumbo, hakuna chungu, tunaangalia tunatoa mpira. Sawa sawa. Asante. Okay, let's get the pulse ox on.
The anesthesia experience is what I like to also call the perioperative medicine experience, entails when the diagnosis is made that a patient should undergo a surgical process, when the patient is seen and assessed in a medical sense, as well as informed about what should happen and what the options are, and what to look out for in the pre-anesthesia experience, up to the time the patient comes onto the table, moved in from the ward or whichever area they are in, onto the table, undergoes the surgical experience in anesthesia with the choice of anesthetic that they have discussed with the patient, which is most optimum for the patient, to safe handover to the nurses in what we call the recovery ward, meaning once you've had your anesthetic, you're taken to a place whereby you are observed to ensure that you are at least at the pre-surgical state of physiology, or if not of physiology, at least a functional state before you can go to the ward. That area is what we call the recovery room, where we say there's a safe handover. And to take you back to the old man I spoke about, who requires to be given some food to build up his muscle to heal. For example, after he has had surgery on a joint, he will need to be able to move. The surgeon has done a very good replacement, but the patient has no idea that he probably needs some physiotherapy or assistance or adjunct, even crutches to move. So you see, that has to have been consulted before the procedure, for example. Then the patient knows, what do I expect? What is my healing process? And who are the other people who are going to come in to help me get well? So the journey for safety in anesthesia is actually a whole team event. Everybody must know their role, must gel into their roles, and must be able to speak up and talk to each other. Basically, must be able to have a close loop of communication whereby if something is mentioned, there is a response verbally and actively.
We are trying to list the important steps for every operation of the 30 common operations that we do. And we are expecting that people in the country will follow these steps so that patients have good outcomes.
Health Digest takes a break, and when we come back, we continue with this discussion on safety in surgery.